Greetings, it's New Zealand naturopath Eric Bakker, author of CanXida Crusher and formulator of the CanXida yeast infection dietary supplements. Thanks for checking out this video again. This is going to be another case study. This is a case study regarding a male, a 27-year-old male. I'm going to read a little bit from my book and then I'll give some explanation and sort of talk around the case a little bit. So this is a guy called Paul. And Paul's a drummer in a leading New Zealand rock band. He came to see me several years ago complaining about his nighttime urination issues. He was getting up 3 to 4 times most nights to urinate. His other complaints included night sweats and stabbing pains in the groin, insomnia, gas and bloating, as well as depression. With no previous history of bladder or urinary symptoms, I was rather intrigued and referred him to a urologist friend of mine who found no abnormalities. I suspected prostatitis, an inflammation of the prostate. I also requested a complete blood count and that came back normal. In fact, all of Paul's results were normal, yet he continued to complain of stabbing pains and night sweats. I started to question him about his relationships and discovered that the problems only started after he began a new relationship with a girlfriend about 6 months ago. I suspected that Paul may have an STD, so sexually transmitted disease, but this was also ruled out after sending him to a sexual health clinic, so where they repeated urine and blood tests and did a thorough physical examination. So I thought, what the heck's going on with this guy? There's something not right here. This led me to conclude that he had an undetected yeast infection, which was affecting his prostate gland. And this is where the stabbing pains down the inner thighs and the groin came from. After a return visit, I convinced Paul to have his girlfriend visit a female doctor friend of mine, and it was discovered that she had a serious vaginal yeast infection. So my suspicions were correct. Paul had contracted and picked up a yeast infection through his girlfriend, and it travelled up his urethra and infected his prostate gland. These infections are more common than you may think, and if you're a male with unexpected pains, unexplained pains that go into the groin area or down the thigh, particularly if you've got any bloating or gas with that, sugar cravings, you may have a yeast infection. So what I did with Paul is I started working with him with a strong antifungal product, very similar but not quite as good as the product that I've developed now. So I've developed a product called CanXida antifungal now, which is way better than what I've ever used in the past. So Paul's also put on a very strict no alcohol regime. Now, a person who works plays in a rock band is drinking usually a lot of alcohol and staying up late at night and partying a lot with people. So this kind of party lifestyle can lead also to not sleeping properly and eating the wrong kind of foods during the day and spending too much time at night time, doing what he does best, is playing music. So in this case, it makes a lot of sense for the practitioner not to give up easily with the patient, but to be relentless and try and find what the cause is. Now, there's no doubt about it. What I often see in relationships is a person will pass a yeast infection from one to another. It's very common for a woman to have a vaginal infection and pass it to a male, and then she may partially recover and he can pass it back to her again. So if there is a problem, both people should be checked out very carefully by the doctor or a sexual health clinic. And if it comes back as a yeast infection, then I'd recommend you try my CanXida Crusher protocol. Also, don't forget to go to CanXidacrusher.com and do my online quiz, the world's best yeast infection quiz. That'll give you a score of mild, moderate or severe. And then you can start looking at good quality treatment. So I hope this video was of use to you today. If you've got or know anybody with these kind of pains, if you're a male or know a male with pain with ejaculation, or just sort of pain in that groin region, and it's all coming back normal or clear, it could be prostatitis. Thanks for tuning in.